Hey guys, I'm Dr. Trey Martin with Pursuit Therapy. Today I want to talk about a condition that I'm seeing more and more clinically in the past couple months, and that's proximal hamstring tendinopathy. So one of the hard parts about proximal hamstring tendinopathy is differentiating it from sciatica. So your hamstring is going to run deep in the butt and it's going to come all the way down to the backside of the knee. And one of the things that gives patients a lot of confusion is the pain can sometimes feel like what you think of sciatica being. And so it's commonly mistaken for sciatica both clinically and by patients. So I've been seeing this a lot lately, and one of the interesting findings when I look at the proximal hamstring tendinopathy from an evaluation standpoint is first thing I do is I test out the low back and make sure it's not something like a herniated disc, stenosis, or anything that could be impeding the sciatic nerve above the spot. And then from there you look into, is it something like piriformis syndrome? So we ruled things out like that. So I have a couple tests that I run through with these patients. And the first time I saw it was a little bit misleading because they tested positive for a lot of traditional low back tests. So it even tests like sciatica and like what you'd think a herniated disc would look like. So one of the prime differentiators I found was these patients would be able to do a full prone press up on their stomachs and they would have no back pain whatsoever. So this helped me rule out that it wasn't a disc-related issue. And then from there, I could test external rotation of the hip and then also go into a deep hip stretch for the piriformis, and that would also be negative. So then I started looking further, and you can find right about where you sit, the bone you sit on, called the sits bone there, right on the ischium. If you palpate in there and you can touch around there, and if that's the site of your pain, you may be looking at more of a proximal hamstring tendinopathy. And this can be brought on by things as simple as increasing your walking schedule, running more, sprinting, jumping, sports. So one of the common things I see too is patients that have glute weakness use their hamstrings more to create hip extension, and this causes an overload of the hamstring tendon at that attachment site. Tendinopathy occurs, the tendon thickens, and then patients will start getting more of a chronic type pain. So a couple of things I've been using clinically that's really helped these patients out is by going through a progressive loading program of the hamstring. So what that means is we start with, if your hamstring was this long, we do exercises that are called isometrics that don't change the length of the hamstring. That helps bring pain down some, and then we can start moving the hamstring tendon throughout normal ranges of motion. The second step after that is we start restoring normal sciatic nerve mobility because, like I mentioned earlier, the sciatic nerve will run right along with the hamstring pathway. So a couple ways we can treat that is through nerve glides and nerve slides as well, and we can move them through different ranges of motion and increase the nerve mobility along with the hamstring. So that's part two. And then part three I've seen really good success with is doing progressive hip strengthening and also some soft tissue work on the back of the hamstring area that can help release some of the area, help things loosen up, and then return to sports slowly. So if you're somebody or you know someone in your life that has been experiencing what you think is sciatica, it may not actually be sciatica. So some of the common symptoms may even be very similar, but it's important to get a look from someone that has experience with this type of condition and get a professional look, whether it be with us here in Orlando or someone in your area, just to help you better differentiate that it's not actually always sciatica and it could be something like proximal hamstring tendinopathy, of which the treatment approach is going to be wildly different. So again, this is just another important reminder that sciatica is a symptom and not necessarily a diagnosis. So it's important to differentiate between all these symptoms, and this could be something that you're experiencing. So thanks for coming and tuning in for this case study today. If you guys have any questions about this, drop them below and we'd be happy to answer them. If you need a consult and you're in the Orlando area, feel free to give us a call. We'll see if we can help you out with a certain problem that's like this in your life and get you back to things like running, playing sports, and enjoying life pain-free. Thanks for tuning in.